If you're watching this video, we already know who you are. You're enthusiastic, you're generous, you're smart, you're talented, and you care about the health of people with intellectual and developmental disabilities. You want to be a part of Special Olympics. In other words, you're a fan. Health promotion is one of the most diverse areas of the Healthy Athlete Initiative. We cover 5 different educational topics: bone health, nutrition or eating healthfully, hydration or drinking water, sun safety, and stopping smoking or not being around people who smoke. Volunteers in the health promotion area have diverse backgrounds. They all have some things in common, though. They have a degree in a health-related field, such as a physician, a speech pathologist, an occupational therapist, a dietitian, a health educator, a special educator. We all have good communication skills. We talk more about this later in the video, but communication skills are key to getting our athletes engaged in health education and interested in making a change. We're enthusiastic. We love what we do. When you get into that venue and you meet the athletes, you forget everything else and hone in on that athlete and know exactly what you want to say to them to help make them make better choices. We're also interested in promoting and encouraging what's called self-determination. And really what that means is making sure that athletes know what to do with the information that we provide, that they're taking charge of their health. Our goal is to make a meaningful connection with the athlete so the information we provide in the health education component makes sense to them and they can make tangible steps towards a change in their health. For that to happen, we need to set up a venue that's warm, inviting, and sets up a learning environment that's based on trust. You play an important role in this. You are seen as a trusted, reliable, and dependable source of information and someone they can talk to freely and openly about what they do when they're at home. In health promotion, we collect 2 different kinds of data. We collect clinical data and we collect athlete-reported data. The clinical data includes height and weight and waist circumference, from which we calculate body mass index to have a discussion about weight management, blood pressure, and bone density scores. The athlete-reported data we collect includes choices about foods, what snacks they like, what they drink when they're thirsty, whether or not they smoke, and how they protect themselves from the sun. You're also key in making sure that the athlete feels comfortable enough to engage with you. Sometimes screenings like this can be unsettling. There's a lot going on, and they're not always used to being asked so many questions at one time. So it's especially important for you to pay attention to those nonverbal cues and make sure that they're comfortable. Person-first language. Special Olympics encourages the use of person-first language. That means putting the person before the disability. And what we do when we do that is you say, "This is my friend Andy. He has Down syndrome." It may not come up so much when you're at the Special Olympics Games because we're more interested in the sport they play. "This is Andy. He did the shot put today." But it's really important to our athletes what words we choose. People with intellectual and developmental disabilities are keenly aware of how we present them in public and in conversations, especially when it comes to words like the R word.
I'm older and you need to treat me more mature. I want the doctor to treat me like more respect and don't treat me the R word.
Gotta be nice, tell what their name is and smile at us and just like all of the stuff. Be nice, not like tease us and like that. That make me mad. Yeah, I just want to be nice to all of us.
Establish rapport. As with any interview, it's really important to establish rapport with the athletes before you begin gathering data. Here's some tips to help you. Target your conversation with the athlete. Many athletes arrive just before or just after their event. Talk with them about their sport. They may come with their coach or family member or a unified partner. Remember, your job is to connect with them, not with their coach and not with their family member. Although the coaches and family members or friends may be helpful in the process, you want to make sure that you're getting information that's truly what the athlete thinks, regardless of their communication ability. Eye contact. It's important that you try to get eye contact with the athlete, just like you would in any conversation. If they're shorter than you are, get down on their level. Make sure that you're the one making the accommodation. For some people, eye contact feels aggressive or invasive. Don't press an athlete who seems to have trouble with this area. Get over to the side of them and look for joint attention. Look at the Choose to Change card together or the food models so that you're both looking at the same thing and you know you've got his attention that way. Use visual cues. Visual cues include gestures, signs or sign language, color coding, marking on the walls or floor, and photographs. These are key for our athletes to understand what's going on in the world. Communication is 55% visual, 37% verbal, and 7% is the actual message. Therefore, using visual cues and strategies is key to any message for any audience, even more so for people with intellectual disabilities. Why? Well, here's a few examples. Visual cues last longer. When you say something, as soon as you say it, it's gone. If you use a sign for sign language, it hangs in the air a little bit longer. If you use a visual cue that's on paper or on the wall or on the floor, it's there for a very long time. This gives the athlete time for the message to go in, roll around in their head for them to understand it, formulate an answer, and then send their message back to you. Visual cues also have no emotion. A visual cue can't get mad at you. It doesn't rush you. It doesn't pass judgment on you. So the athletes get a clear, simple, non-judgmental message when you use visual cues. Use age-appropriate tools. Do not use children's messaging or childlike games or visuals for adults. Remember, the average age of a Special Olympian right now is in their 20s. Therefore, you want to choose something that's appropriate for a young adult moving out on their own. Wait. Allow for processing time. Wait 10 to 30 seconds before you get a response from your athletes. During that time, it's important to stay engaged with the athlete, respond to their nonverbal cues, and don't be distracted from the conversation. Of all the skills, waiting is the most difficult and one of the most important for us to use. If you have a very busy and noise-filled venue, this can be particularly challenging. Try to remain focused on the athlete and focused on creating a quality interaction between you and them. Sometimes we use role play in our trainings to demonstrate some of the challenges you may encounter in your health promotion venue. Here's a short example we'd like you to analyze.
Oh, you've already got something. All right.
Well,
What about?
let her pick it.
What about? You pick one now. What's your name? Okay.
Andrea.
Andrea. Andrea, you pick something now.
What about crackers and peanut butter? Crackers and peanut butter? Popcorn?
Popcorn.
What about tuna salad? Let's do tuna salad. That should probably go.
Andrea,
Where should that go?
Maybe Andrea can
Oh, no,
decide.
you don't eat that.
This is just pretend
That probably
salad.
goes here, right? Happy face?
No, I don't like that. I don't like that.
What about pizza? Where does that go? No, that goes sad face.
Excuse me. Can Andrea choose?
Oh, she's choosing.
Oh, okay. Well, Andrea, how about choosing a fruit? Do you know which one a fruit is? Yeah. Well, what do you think? Is fruit something that makes you feel good? Good job. All right. All right.
I choose to change. One tool available is the I Choose to Change series of cards. Here's how it works. When the athletes leave the health promotion venue, they're offered an opportunity to choose one area to make some changes in their habits. The card serves two purposes. It's used as an athlete report card that shares information from the key findings, such as their body mass index or their bone density score, and gives them an idea of whether or not they need to visit with their physician. The other side of the card lists some easy, tangible first steps to changes for better health in one of the content areas. The volunteer fills in the key findings on the athlete report card side of the card. Then they discuss what steps are listed on the front side and what new ideas the athlete has for making healthful changes and choices in their life. As a healthcare professional volunteering with health promotion, athletes are really looking to you to connect with them.
But talking to the doctor, it's like, I try to other things sometimes about, healthy stuff and, like I don't feel good or I get earaches or I get headaches or tummy aches a lot, or allergies a lot, and sometimes I wonder if she's paying attention or if she's just being a doctor that knows everything and is telling me anything I don't know.
There you go. So when you talk to your doctor about it, do you want her to be looking at you? Tell me what you want her to look like when she's listening. What does listening look like?
Looking at me, eye contact, and just knowing what I'm saying and comprehending what I'm saying.
I like to see that they look at me.
Yeah.
Because when I had it in Dakota Dunes, we had this one doctor. She's, at the paper down here. She didn't look at me.
So it's important to look at
It's pertinent if you're with the doctor, they look at you. So that way you know that they're there. If you're like talking to someone who has like seizures or autism or all kinds of stuff, if you're their doctor, look at them. Because otherwise, they feel like they're being ignored.
One final thought to keep in mind. One of the most important roles you play as a volunteer for the health promotion venue is a role model. While you're working in health promotion, please model the expected behavior. Walk the walk with the athletes. That means if you're outdoors, put sunscreen on, wear a hat and sunglasses. Have healthy food choices available in the venue whenever you can. Drink water instead of soda. Be active. Get plenty of sleep the night before the training. Wear appropriate footwear and take good care of your teeth. As a volunteer in the health promotion venue, you're key to our successful communication. Thank you for your time, your energy, and your willingness to make a difference for people with intellectual and developmental disabilities.